My name is Sacia. I currently serve in the role of Chief Operations Officer for Rock Valley Physical Therapy. I'm a PT. I graduated from Washington University in 1993, so I've been in the profession for quite some time. Purely as a PT, it was about helping others. I had an injury back when I was in youth, adolescent baseball, and had therapy, and I thought it was a really cool thing that you can help kids get back to sports. Little did I know the breadth of what we do as a profession and all the things that we serve. I was passionate about patient care, and then when I came to Rock Valley, eventually I started to get into more interest of the administrative side. So just kind of did some things about measuring quality. Like we tried to figure out our own outcomes back in the late 90s. We did, measuring some metrics that indicated you're doing a good job. And then from there, I just continued to add on and have more responsibility tied to the point where I became overseeing operations of our practice. We always talk about our metrics should tell the story of great patient care. So if patients find value in what they do, they're going to show up for their appointments as measured by an arrival rate, for example. If they have a great experience with a therapist, they're going to finish their course of care, which is measured by your number of visits that they come in. If they have a great experience and a great outcome, they're going to come back, which will be more new patients down there. So we don't look at a metric in isolation, but we use those metrics to tell the story of how our therapists are taking care of their patients in their communities. What I find very rewarding about that is not just that we're relying on a specific number, but it's a set of metrics that tell us that we're doing a good job. We're growing, and we're taking care of our patients, and we're taking care of our communities. The pain point that we have today, and there's been some people that have solved that, but we hadn't gotten to that point yet in any of our previous vendor experiences of getting data at the right time to the right people in the right fashion. We have the data there, but the challenge is to get it out and put it into a format that you can get it to people frequently. It would take a lot of data and put it into Excel. We embarked on a couple of experiments to try to get to a BI tool, but it didn't work out with some of the data we were getting from one vendor, and the dashboards just never were created. But for a long time, I've been asking, for the ability to take data to expectation and to be able to give that to my leadership team to help them make good decisions. But we also had that the state of Iowa cut payment for their speech services. So we have 2 pediatric practices. That's been a challenge to look ahead to see how payment's going to come and are we going to have a viable practice there, right? And we just met about that in the last week, and then all of a sudden the state shows up today for their state audit. So all of a sudden now the therapists are panicked. They got somebody that doesn't know what they're talking about in terms of looking at chart reviews and doing all this, but they're following a state audit on the rehab agency. So taking a step back of what we've seen over time is that you've seen payment for services flatlining, right? Where insurances are not looking to pay us. Medicare's cut us year over year for several years, right? So payment has been a challenge. So where that has to come in is then to maintain a margin, you have to look at your expense side. So what we are really eager to work with Athelas on is how can we use technology to reduce our labor, to reduce our costs, reduce the administrative burden. Documentation is a burden for all the therapists, and they may not be as willing to say yes to that next new patient because it might take them 15 minutes to do their documentation. So can we use the scribe and the ambient to bring that time down so that they'll say yes, and maybe they see another visit or 2 a week. And if they do that, that lowers our expense per visit, maintains our margin, and which is something that I'm really looking forward to. Our therapists went to school to take care of people. And compliance and the administrative burden and the authorization requirements is taking too much time away from the patients. So if our system is efficient and automated, if it allows therapists to get back to doing what they do best and taking care of patients, that would be a great outcome in my opinion.